last year when I did this session, there was too much information giving within the time together. So I've taken some aspects out of our time together in order to allow us more time to think about how to actually do this in practice. What's health promotion going to mean for me as a dietitian? So we're going to start with a little bit of information about the kind of key terms and principles behind health promotion. What is it? What do we mean by that? And really, if you go back historically, health promotion started purely as health education. And the whole point of that is you have activities that help people to learn about health and behavior change. So the whole idea is to raise awareness of health problems. This might have been smoking or sanitation or all sorts of different things. So you provide information, you increase awareness, and the idea behind it was that therefore motivates people, persuades them to make a change towards a healthier way of living. And this approach has been highly criticised because the whole idea behind it is you give people information and they're therefore going to change what they do. And that is clearly not what happens in many, many cases. If it did, we wouldn't have anybody smoking in this country. If it also did, we wouldn't have anyone living with obesity and overweight because they would know that that's not the healthiest way to be living and they would have made changes. But it's far more complicated than that. So this assumption that more knowledge and more information leads to behaviour change is a very incorrect one. So not to say that health education isn't useful, but we need to put it into the context. So education, provide information, raise awareness. Health promotion is much broader than health education. So it's a wide range of activities, interventions. And the whole idea is that we are enabling people to take control over their health. So much more than just information and awareness. And what it does is consider the whole environment. If you think of the short video about the Ottawa Charter, you can remember that that's much more about changing the environment people live in. And how might that enable them to make changes that will benefit health? And the Healthy City programme is one really important way that that happens. And what health promotion does, it doesn't equate health with health services. So we aren't talking about purely NHS as a way to improve health. We're talking about much broader concepts than that. And it uses a variety of disciplines to understand and work on interventions. It can be directed at individuals, families, communities, or whole populations. But rather than public health, which is whole populations, health promotion includes individuals and families and communities. So it's part of public health, and health education as part of health promotion. So you can see we get onto those broader concepts. So we have some principles behind health promotion that we really kind of need to think, oh, this is how it works and how it should work. So it's looking at broader concepts than just a disease. It's looking at behaviours as well and whole population. So much more holistic than just focusing on cardiovascular disease, for example. The idea is that we look at the causes of ill health that are beyond the control of the individual, as well as just what the individual does. So both of those concepts. So it should be equitable. We're assuming that all people have needs, and it's not just certain people that we're focusing on. So we're looking at broader concepts, causes of ill health, as well as what individuals do. Health promotion is often multi-strategy. So if you're looking at something like obesity, for example, you're not going to choose one way to try and overcome the concerns of obesity and overweight. We're looking at lots of different things that might support people in lots of different ways. So multi-strategy approach. It should be participatory. So we are trying to encourage people to support themselves, but we're working to help them do that, not assuming they can just do that. So we're looking at public participation, people having a role themselves alongside those who are trying to create or empower them. So it supports self-help. And it's not just at different levels, the multi-strategy, it is multi-sectoral. And what that means is we're not just talking about health, we're not just talking about social care, we're including local authorities, we're including local communities who might work together to support the health of their community, their area. So all of these principles, being holistic, equitable, multi-strategy, participatory, and multi-sectoral, are underlying principles of the way that we work with health promotion. So there's different ways that we might think about promoting health. And I just want to go through 3 core ones that are seen as really fundamental ways that we might work with people. So let's start with advocacy. This is about defending and promoting a cause. So someone might be an advocate for a particular population group. And advocacy is about removing obstacles, decreasing discriminatory behaviour, for example. So we might be looking at the needs of specific at-risk populations. So you might look at the needs of the South Asian population in relation to their risk of diabetes, which is much higher than the risk of people of white ethnicity. So we know that people from that specific ethnicity are more at risk. So how do we support them? How do we remove the obstacles to them supporting a healthy lifestyle, accessing health services, and how do we decrease discrimination against people? So the BDA is an organisation that you know of course, but it collaborates very widely in trying to address some of the issues with the UK food and nutrition agenda. So they're advocates for healthy food and nutrition. So they challenge the government, they get involved in lobbying and in consultations, they identify needs, they write letters to government, they try and get roles on all party committees. So the BDA do this nationally, but members, so that yourselves as students or as full members of the BDA over the next year, you can advocate at a local level. Why are we not supporting this population group? What can we do to support the health of this population group? So you can get involved in that as well as part of the role of a dietitian. Another role of a dietitian is around the whole idea of enablement. So this is working in partnership. Partnership working is a core way of working in health promotion. And what we're trying to do is work with others to make sure that everyone is able to reach their full potential. So we look at identifying the needs of different people, looking at networking and developing resources, supporting people to develop their knowledge and skills. So the more knowledge and skills people have, the more likely they are to be able to feel motivated to make changes. And this goes back to the COM-B model. So this is about supporting the development of capability, for example. So it links very much with that. But we're looking very much at things that are long-term. So we're not looking at something that's just going to support people for a short space of time, for a few months. We are going to be looking at things that should continue long after we've finished our involvement with a particular community. And you need to think about this in relation to your assignments. How sustainable is it? What's going to enable that to continue to support that group of people after the intervention itself has finished? So enablement is a really important part of what we do. We may also end up being mediators. And with that, we may be looking at supporting different organisations to come together. And this might be through coordinating. It might be trying to build bridges between organisations that don't communicate well, and try and make sure that people are working in the same area, working towards the same goals. So partnership working, you'll find chapters on partnership working in the textbooks, is so important. You know, if you're going into schools to deliver an intervention, you need to be working with school nurses, catering staff, teachers, parents, children. So you pull that resource together and get everyone working in the same way. Could be through working groups. You can be doing that at a local level, in a local school, for example, but you could be doing that at a regional or a national level as a dietitian. If you're looking at the role of the World Health Organization, they do this on a global level and to try and promote health. Because so often organizations are working in different agendas, working in different directions, and that can decrease the ability of people to change their health and change their health-related behaviour. So it's all about trying to get people to work together to the same goals.